are very fortunate to have Dr. Muhammad and Hilary Reichlin, who are advocates giving voice to the unheard and the underserved. They work to heal individuals, families, and communities. And so with that, I'm going to turn it over to Hilary.
Thank you, Marla, for your kind words and such a warm introduction. It's really wonderful to be here, and thank you for this opportunity. So I am going to try to share my screen. All right. Everybody let me know if you guys can see my,
Yep.
Everybody good to go with my slide deck?
Looks good.
Wonderful. All right, wonderful. So it's my understanding that Marla, you have helped facilitate a series of talks related to, as you said, community health, mental health, financial health, family health. And today we're here to talk about behavioral health care for yourself and for your loved ones. And as Marla mentioned, Dr. Muhammad and I have been working together for about 6 years. And I've been in practice about 14, and Dr. Muhammad's been in practice about 12. So we're veterans at this point. What we hope for you to take away today from today's training is understanding the importance of and caring for addressing mental health needs from both a medical perspective and a psychological perspective. Going to give you actual concrete resources where in Philadelphia to access mental health care and behavioral health care, medical care, other types of supports, and even domestic violence, grief supports, other supports that you have access to. And as I mentioned, plugging Spectrum for all the good that we do in the community as well. So let's talk about stress. Let's get to it. So I think it's really important for us to note the sort of context that we're living in now, and we have a lot of new stress. As Marla mentioned, being kind of locked away in our homes for many, many days now. I don't even know what day, it's Groundhog's Day every day. As well as being with our loved ones. All of a sudden now you're an educator because you're taking care of your kids' virtual learning. Maybe you're caring for loved ones who have lost some of the supports in the community that they were going to elsewhere. Some people are no longer employed or had a period of being furloughed and had to worry about their financial security. Grief, being separated from our loved ones. And also a big piece of this grief is the complicated grief that accompanies not being able to share the final moments with our loved ones and participate in some of the rituals and rites that we have in funerals where they're only allowing so many people. And there was a real period of time where no one was allowed to be in the hospital, and people were unfortunately passing away without their loved ones nearby. And there's some trauma to that as well. And it's really important to think about the ways that being under stress every day, not just, an hour or two before your exam or before some sort of other tests or putting on a presentation. There's daily stress, and thinking about kind of the chemicals that we're releasing in our body when we're living under stressful conditions every day. Dysregulated blood sugar, which is precursors to things like diabetes, elevated blood pressure, which puts you at risk for high blood pressure, stroke, other cardiovascular risks, insomnia, really common report right now, and for a lot of our patients that we're seeing, depression, anxiety, PTSD, other mental health issues, they're on the rise. Even just other mood symptoms, anger, irritability, reduced frustration tolerance, kind of getting more upset quicker. And then maybe some of us are leaning on unhealthier coping skills, cigarettes, drinking, emotional eating, things like that. Then we also really need to think about how else maybe our body's holding stress. And we're so good at kind of pushing away stress or keeping it moving that sometimes our body is going to be the one that's going to give us the red flag. Is that back pain, particularly in our lumbar region, neck and shoulder pain, jaw pain, maybe we're grinding our teeth at night, GI upset or upset stomach, feeling nauseous, headaches, kind of feeling a tightness in your chest, maybe your blood pressure's up, and feeling fatigue. Fatigue is a really common symptom that could be indicative of stress as well. And we recognize it's really difficult to ask for help. So 17.3 million adults in a given year, 18 and up, are going to face depression. And then really key to today's topic, which is 1 in 6 Americans working full-time or part-time, and they're assisting with the care of an elderly or disabled family member, which is much more common now with COVID, 40 to 70%. So that's anywhere from 4 to 7 out of 10 people who are caring for a loved one are reporting significant symptoms of depression. Depression is the leading cause of disability worldwide, and it's a major contributor to the overall burden of disease. And despite it being really successfully treated and having a lot of treatment options, nearly 2/3 of people suffering from depression do not actively seek help or receive treatment. And I just thought this was really nice, kind of understanding why it's hard to ask for help, because we think about burdening our loved ones. There's some shame associated with telling people we're not okay. There's fear. There's fear of projected judgment, or that, people think that you can't handle your life anymore, or just wanting to it's easier sometimes to put on a happy face than to really tell people what's going on. So there's a lot of reasons why it's hard to ask for help. These are phrases that I'm using that I hear in my practice. I don't want people to worry about me. Everyone has their own problems. They got a lot going on themselves, or I just need to be strong. And our common culture associates strength with not expressing emotions, but feeling our feelings is part of the vital human condition. And all of our truths, whether we're talking about it or not. Sometimes there's a fear of retribution or being judged. So talking to somebody in your family or somebody who has skin in the game is a little bit tricky. So sometimes it's hard to open up to other people who are kind of in some of the same boat. And as Marla mentioned, the community health aspect is we're in the same community, so maybe we're facing some of the same problems. And then there's stigma. I'm not crazy. I'm not going to go where crazy people go, which is when people are asked to seek specialty mental health care, seeing a therapist, or going to a community mental health center, not a community health center. And the average number of times someone goes to see a therapist, once. And some of that has to do with sort of the process in specialty mental health care, and Spectrum's so good at reducing those barriers. So it's one of the reasons why it's so easy to promote total body health, because we don't have systems set up to make it really difficult for you to access, which is multiple sessions to get to the right person or get to a doctor. And at Spectrum, you come in and you're getting access. It's really hard for us to be vulnerable. So taking a risk and going to mental health care, if it's not ease of access, people are going to drop out. And why does this matter? Because mental health care is just as important as medical and physical health. Because mental health support and treatment is often necessary to recover from medical issues like stroke, heart attack, people who want to, maybe have gastric bypass, whatever the things are, you need mental health care in conjunction or alongside physical care. Depression and anxiety are chronic health conditions the same way as diabetes and high blood pressure, and they should be treated the same. And then sometimes it's easier to talk to people that aren't in your family. So let's normalize that. So where to get help? And I got a lot of understanding from Marla and Jasmine in our earlier talk about kind of what the target audience was. So, these are potential employer-based benefits, but my understanding is some of the participants and members in this community and group may be sole proprietors or not have some of these benefits. So I'll just do a quick run through. And one that's particularly important for people who do have employer-based benefits is the possibility of having EAP, which is brief counseling that's through your employer, typically 4 to 8 sessions. And that is usually accessed through your human resource representative. FMLA is if you need to take time off. Usually it's more about securing your job if you need to take that time off. And if you do have health insurance through your employer, your benefits are going to vary based on your contract, but they also sometimes have other wellness resources, like they may help you quit smoking, or give you reduced membership for gyms, or give you reimbursement to go to the gym. So there are some wellness resources tucked away in your medical benefits. But not everyone is offered health insurance. And even with health insurances, sometimes the copays and co-insurances for specialty mental health care can be high. $60 copays. Are you going to go once a week if you have to pay $60 a week? I mean, that's a pretty considerable chunk of money. So what's out there? That's where Spectrum comes in. So we are a 501c3 nonprofit, and we hinge on providing access to everyone regardless of their ability to pay. We offer comprehensive care for all of our patients and family members from birth till death. So we start with prenatal care, and we go all the way up to geriatric care. We treat, generations of families at Spectrum. And we offer sort of sliding scale for people based on their income if they do not have insurance or are underinsured. And we have locations, our primary locations in West Philly, but we also serve North Philly, South Philly at Reed Street, and hopefully by the end of this year, we'll have an office in the Northeast as well. So we're serving the greater Philadelphia region. So we don't turn anyone away regardless of their ability to pay for any of our services. And then, as I mentioned, we set up those sliding scales. And this is really one-stop shopping for all your healthcare needs. Dental. We have a podiatrist, a foot doctor there once a week. We have prenatal care. We partner with Penn Family Medicine and Penn for our prenatal care. We have women's health providers. We have a pediatrician and several family care providers. We have our Right Choice Pharmacy, which offers low-cost medications independent of your insurance status, and they also offer delivery. Behavioral health care. We have a dietitian, so we provide nutritional counseling. And then we also have case management and care management services, and they do a lot of support for the medical providers and making sure our patients, who we know carry the higher disease burden in the community, they help with other social determinants of health, cost, transportation, access, education levels to make sure that they're getting to the right people. And why is this important? Because as we've been hammering this morning, access really does matter. And so does treating the whole person. Medical outcome studies reveal that depression results in more functional impairments than other chronic health conditions like diabetes, arthritis, and angina. Being able to talk to someone in your primary care office reduces the stigma and gets you right to the person that you need. So many times, Dr. Muhammad and I have worked together where she's a person that needs help in that moment. She's going to come knock on my little cubicle wall and say, Hilary, I got somebody for you. This is a person that really could use some support. Is that a new diabetic? Is that a person with a new medical diagnosis? Is that a person just going through some really tough times in their life? It's really, we've had to pivot in a lot of ways for offering the same level of service through telemedicine, but we do. So we're still available on a daily basis for our medical providers, for those people who need that support. And we think about a lot of young adults, 18 to 30, really only come to the doctor for urgent needs or emergent needs. And we really want to hammer preventative health. That family health, preventative health from birth till death, it's the key to not just long-term health, but long-term quality of life. Are you living long, and are you living well? And that reduces the burden, which is really important right now, thinking about reducing the risk on ERs, doctors, and hospitals, which are already kind of stretched thin. Resources are really being directed at managing the COVID crisis. And a lot of people are walking around with depression, anxiety, trauma, grief, stress, and they don't even know it. There's been times I'm in the room and I'm asking patients questions, and they really had no idea that they are walking around with trauma, or walking around with a lot of burden from their childhood, or walking around, and those things matter because it can lead to negative behaviors like smoking, insomnia, and also things like heart disease, diabetes. And VHCs, with my role is we're kind of a Swiss Army knife where we really kind of go in the room. We're going to assess the problem, give our feedback to the doctor, and we are a team of people there to help for maximum support and benefit and recovery for any wide range of issues. So where else can you go without insurance? So all city health centers, and I think there's about 10 located throughout the city, also offer that same primary care behavioral health comprehensive model, and they do not turn somebody away regardless of their ability to pay. Council for Relationships, which has an office in West Philadelphia, they offer sliding scale therapy for individuals, families, and couples, and that's based on your income. The Center for Growth, they offer a tremendous number of group therapy and support groups. I believe it's about $10 of a class for drop-in. Grief and loss, postpartum and new parent support groups, anxiety and depression support groups, chronic pain support groups, obsessive compulsive disorder support groups. So a wide range of both medical and behavioral health conditions. Psychology Today, actually, if you go to this website, it'll allow you to search for clinicians based on a number of criteria. Where you live, are they offering telehealth? What insurances do they take? What are their fees? What are their areas of expertise? Gender, LGBTQ. And Talkspace is a subscription service where it's actually text, phone, video access nationwide to a number of clinicians and licensed therapists in each state. So it's more if it's hard to access and you're working 7 to 7 and you're super busy and you just need a quick check-in with someone, that's someone available by text or phone. You ever feel like this? There is a lot we're juggling at any given moment, at any given day. And I think we really need to talk about balance. So we want to check in on our loved ones because we're separated from them. We're quarantined and we're socially distanced and we're going on 1 year. And I don't think any of us really, maybe some of us, some of the smarter ones, projected that we would be here. But I think we were all maybe hopefully oblivious to how long this would really take to recover for any number of reasons. So there's a real burden now, isolation, loneliness. And so thinking about checking in on people is give someone you love a call. Are you thinking about them? Text them. Plan or schedule like a phone date. Drop off a meal. Maybe sit outside if it's not the full onslaught of snowy winter. Ask people if they're okay. There's a big belief that if we ask about suicide, it increases their chances of that happening, and that's not true. In fact, some people are just waiting for someone to ask. So don't be afraid. But it's important to remember boundaries. If you don't have gas in the tank, you are not going to take anybody for a ride. So it's really important that you check in with yourself. And if you don't have it, is there someone else that they could go to? It's really important that you are taking care of yourself because to take care of other people, you really do need to be okay. So some alone self-care activities, is that like cooking new meals? Maybe you're crafting. Maybe you're doing some puzzles, quiet time, journaling, exercising. It's hard to do now because we're all just stuck in the house. So can you find an exercise video? Do some Zumba at home. Maybe doing some stretching or yoga. Some safe socialization. Is that Zoom or doing something outside if the weather permits? Maybe it's learning something new. So ultimately, providers like myself and Dr. Muhammad, we're really hoping to teach you how to self-manage. We want you to have the tools to be able to take care of yourself. So we're always there to support and help, but ultimately, how often are you going to the doctor? And so it's really important that you're learning the tools and the skills and the knowledge and the education that you can apply that to yourself on a day-to-day basis or offer that to your family as well. And then there's some apps, some are free, some are paid. Insight Timer, if you want to do some timed meditation. Some Calm app does some guided meditation and some relaxation exercises, some sleep meditations. Here's some crisis resources. I often share these with our patients. There are a number of crisis resources. They're like mental health ERs throughout the city. Unfortunately, I believe the one closest to our site in West Philly, Mercy, their crisis center has closed. So the next closest place would either be Friends Hospital. They have a crisis center and they're on the Boulevard. And then also Hall Mercer, which is down by PA Hospital at around 8th and Spruce. They also have sort of a mental health crisis response center, which is essentially where you would go if you're in a mental health crisis. There's also some numbers. The Philadelphia Crisis Intervention Hotline and the National Suicide Hotline, they are manned with a number of behavioral health specialists and clinicians. You don't even have to be suicidal. It may be 2 a.m. and you don't have anybody to talk to. There's somebody on that other end of the phone. So some other grief support or bereavement resources. As I mentioned, the Center for Growth, they offer a number of therapy as well as support groups. And it's not insurance-based. The Uplift Center for Grieving Children helps children grieve the loss of a loved one, strengthening families. There's grief support groups targeted for people who have survived a family member suicide or a loved one suicide or loss of a spouse, the National Widowers Organization, grieving.com and meetup.com, ways to find grief support in your area. And these are just a number of resources that are related to specific losses, infant death, death of a child, drug-related deaths. The opioid epidemic hit Philly pretty hard. So that's some resources for us as well. And then again, for suicide and unfortunately, one of our community problems is homicide. And that's something a lot of our patients have felt personally in their lives. And it's a really tragic community problem. So there's some resources for people who have lost a loved one to homicide. And there's also domestic violence, which is really important to mention now as well. Intimate partner violence is on the rise because people are locked down with their perpetrators. This is the Philadelphia number for the domestic violence hotline. There's, again, counselors and trained professionals on that line. And they also can help set up safe houses, pick you up, and you go to places that no one will know where you are if you're ready to leave an unsafe situation. And these are some additional domestic violence resources. Women in Transition, the Lutheran Settlement House. Some are for counseling for bilingual Spanish and English, and then Women Organized Against Rape. And then some additional community supports. The Anti-Violence Partnership of Philadelphia for the Families of Murder Victims. The PCA Caregiver Support Program, as a lot of us have become unofficial caregivers or official caregivers for our loved ones during this time. And It Takes a Village assists with family group decision-making around truancy, behavioral health issues for their children, mental health treatment for a family member, drug and alcohol recovery and caregiving resources and supports. And that's my information. I'm available to answer any questions. I'll give Dr. Muhammad an opportunity to add some information if she'd like.
Thank you so much, Hilary, for this comprehensive, very well-resourced presentation. I did have a question from an audience. I'm just going to read it to you. Good morning. Do you have a list of African-American couples, marriage, counseling in Philadelphia? I responded, but I'll let you also respond as well, Hilary. In my search for my patients, I found that the search engine, the web offers like the most up-to-date information. And so just like clicking in African-American therapists in Philadelphia, you'll get a list of it. My experience is that a lot of those therapists may not necessarily accept insurances. And those that do accept insurance work in the community health center, but they wear many hats as well. They're not just focused on marriage counseling. So that's just from my research as a primary care physician. Hilary, if you can like speak on from your perspective.
Yeah, that's a really good question. So my recommendation for a few ways to access, if you're knowing specifically that you would like a clinician of color, either for individual or couples therapy, one would be going to psychologytoday.com, because that does allow you to access very specific search criteria. So if you wanted, you could look up clinicians of color and then couples therapy in this area, and you should be able to find one. That's one option. I do know some agencies, they do take insurance, and unfortunately, if you don't have insurance or in network with their providers, it could be a bit hefty. So Equilibria, they do a number of clinicians of color. And then sometimes I do recommend, and maybe not for couples therapy specifically, but even if you're just looking to match with a clinician of color for individual therapy, if you look up some larger group practices, for example, Delaware County Professional Services, and they have a few locations in Center City and West Philly and out in the suburbs as well. They're a large group practice. So the benefits of going to a large group practice is that you're going to be able to find somebody that's going to match with you a little bit better, whether it be a more seasoned clinician, a male clinician, a female clinician. So that would be if you have insurance and it's a commercial plan like an Aetna, a Keystone Health Plan, something like that. The other option is Counsel for Relationships is wonderful because they are sliding scale based on income and they are really reasonable. The only drawback of Counsel for Relationships is that they're a teaching school. So there's a lot of budding clinicians. You may be able to ask about getting connected to a seasoned therapist. All of them are being supervised and observed by seasoned clinicians and the trainers, but what they may, depending on the circumstances, I'm not quite sure, they may match you with a student or an intern. So that's somebody that's working on getting this extra licensure or credentialing or other types of, because I think there are LMFTs, which is a licensed marriage and family therapist. So some of them are working on a degree and they're getting their clinical hours. So that's kind of the only drawback is sometimes you're going to get somebody that's in the process of becoming a seasoned clinician, but they're not quite there yet themselves.
Hilary, can you repeat that source before the relationship organization?
Yes, Counsel for Relationships, COUNCIL, Counsel.
The one before that, what was the bigger organization?
Equilibria is one they have a couple locations in Philadelphia and they have a lot of clinicians of color. They take most commercial plans. And then I was mentioning kind of group practice. The one that I use for other commercial plans are Delaware County Professional Services.
That's the one.
And yeah, they have a few locations, I believe in Havertown. There's one at West Philly, and then there's one right there at Center City. So there is good access. And I should sort of also give an asterisk. The majority of these places and clinicians are offering telehealth, telemedicine for the time being. So there's going to be, at least for the foreseeable future, telemedicine being a viable option. As we're increasing our vaccinations and increasing the people in the community that are vaccinated against COVID, we're hopefully slowly trickling back to in-person care. At Spectrum, we do have in-person care every day. We have a limited number of providers in office. So if there's some issue that you need, there is someone in office. Prenatal care is still going in office. Obviously, dental is still going in office. And then we're moving back. We do have 1 or 2 medical and women's health providers on per day to get patients. And obviously children still need immunizations, vaccinations. Some people still need to be seen in person. So we are offering in-person services, but a lot of what we're offering right now is telehealth. So a lot of these places are offering telehealth now as well.
That's great. Thank you for that feedback. The reminder for folks that came in late, if you have a question that you can also ask anonymously if you don't feel comfortable revealing yourself, There is a Q&A box at the bottom of your screen. Click there and Hilary and Dr. Mohammed can either answer them live or type in the questions. You can also raise your hand and we could unmute you for you to ask your question or type it in the chat box. I see a question from Amelia. Will there be audio of this Zoom to listen to again? We are providing a recording of this on our website and also a copy of this PowerPoint as well. So we can post that link in the chat box for you to save at a later date. Two things actually I have one question, but before I ask that question, I do want to add earlier what you were saying about the clinicians who are providing services, even though they're still getting certified in the sorry, what was that?
LMFTs?
Yes, that. I personally, when I first started out getting mental health services and seeing a therapist, my first therapist was someone that was still in getting their master's, and she was phenomenal. Unfortunately, she relocated out of the state, but she was great. I wish I could have kept her. So I just want to put that out there for people who are new to this and might be a little hesitant about that. Don't be. They're really, really amazing. The question I wanted to ask you is, I actually have a family friend older who is looking for counseling and hesitant because their previous experience was not positive. And so for folks that are out there that may be in a similar situation, do you have some tips for people on how to go about looking for the right person for them? Because it's not always, it's not always a good first match.
That's a great question. And I tell, unfortunately, part of care, both medical care and mental health care, is staff change or turnover. So a lot of patients, they find somebody they like or they don't have a good experience, and they hold on to it and they carry it with them. So a lot of it is having the courage to trust again and finding the right provider. One thing we mentioned is advocacy, which is asking for what you need, and don't be afraid to say no or to continue to advocate for what you need, both medically and for behavioral health care. If you want a male therapist or you want a female, ask for it. If you want a more seasoned clinician, you may have to wait, but it may be worth it for you. Most agencies, and this doesn't work with like single private practice as well, but for group practices, they are going to make an effort to really match you based on like your level and need. It's another great plug also for Spectrum, which is if you need comprehensive care, you can get access to everything as a patient, no matter if you're a prenatal patient, a women's health patient, a dental patient. You can have access to a behavioral health specialist, which is somebody just to give you support while you're looking. I like to think of myself in a lot of ways as a safety net under a therapist, because I'm always there, whether you go to therapy or not, if you lose contact with your clinician or not. And sometimes I don't have a magic sauce for getting yourself back into care other than to say you are deserving. And I tell this to people all the time. If you broke your leg, would you debate going to get care? If you broke an arm, would you debate going to get care? You wouldn't sit outside the ER saying, should I, shouldn't I, should I, shouldn't. So we're so trained to understand I'm hurting, there's pain, something's wrong. And we're so willing to get help for that, but we're so much less willing to get help for mental health. And is it because we can't see it? Is there the shame and stigma? Is it the intergenerational messages that we receive, which is don't talk about your problems, keep your problems to yourself, keep it moving, don't let anybody see that there's something wrong. I mean, there's so many messages that we receive about, just holding on, being strong, and really maybe normalizing that. And specifically to the question of if they need help, it's okay to have a session or two with someone and say, this doesn't feel like a good fit, because the way you're going to make progress and get work done and make change is by the therapeutic relationship and rapport. So you could have a great therapist. If that's not a good match for what you need or your personality, how are they helping you? You know, so their skill sets may not match your needs. So doing a little bit more advocacy and saying like, I deserve what I want and I want what I deserve.
I'd like to add, when we hear community health centers, we conjure up like a misnomer about who the center serves. And so we tend to think it's low income residents, but talk about the private pay insurance that you accept. And so if a community health center happens to be in your area, they're taking your private insurance also. And it's almost like one-stop shopping. I remember when Spectrum built, for anybody who does not know Spectrum Health Services, it's located at 52nd and Haverford. It was a PIDC client, so we helped put funding into the construction of and it's an absolute state-of-the-art facility. It is beautiful. And to be able to go in there and see beautiful facilities, the exam rooms, the high quality of professionals. So you're not walking in these health centers as a corner store mom and pop center. These are high quality, state-of-the-art facilities with, and I recall a few years ago when Spectrum celebrated its 50th year, that it was a room of professionals, primarily Black medical professionals, who are on staff, just like Dr. Muhammad. They're at the hospital at the University of Pennsylvania, they're at Pennsylvania Hospital, they're at Jefferson. And so don't let a misnomer of community health center keep you from getting the care that you need. So that's one thing. The second thing is, I'm reminded of a client I had who was in a business, but his primary work was psychiatry. And so I was curious because he was a psychiatrist. I wanted him to analyze me. And he told me his primary base of clients are CEOs of corporations who are in charge from 9 to 5 or whatever their hours are. And then when they go home, the wife and the kids don't listen. And so it was creating mental conflict. And so for business owners who think you have to have it all together, there are CEOs of major corporations who are seeking therapy on a very regular basis. But you don't see that part of them because you only see the exterior. So for business owners, there is an expectation that you have to have it all together. And you tend to think there's not a group or a cohort of business owners who you can talk to about the emotional issues that impact you. And so someplace like Spectrum, you can walk in and get the services or get referred to a place that can meet those needs. And by the way, when you're there, you can get all of these other services. They have cooking classes for nutrition. So if you need to know how to prepare better foods, healthier foods, all of that you'll find right there. So those are my 2 cents.
Yes, thank you so much, Marla, for shining a great light onto Spectrum and putting a great advertisement. And to speak to your first point, yes, health, there's always been this, misconception, misnomer with community health center or clinics, because Philadelphia is rich in a lot of medical facilities, including health community health centers. But there's a distinction between like the city Philadelphia health centers and Spectrum, which are federally qualified health center FQHCs. And yes, the city health center does cater more towards those who are uninsured and underinsured. Spectrum, we, as Hilary mentioned in one of her slides, we cater to all uninsured, underinsured, Medicaid, private insurances, and those. In fact, like over like 85% of our patients have insurance. And so thank you so much for highlighting that, Marla. And Spectrum, we are world class, or at least we're trying to become, the best, world class in Philadelphia, in the community that needs it most. And so just emphasizing what you said, Marla, and thank you so much for putting it well put.
And I'll also add that particularly in the Black community and the Brown community, we've heard so much through the years about the stigma associated with seeking mental health. And I'll tell you, every one of us on this call, I am sure, we know someone from the neighborhood, someone from when we were growing up, some family member who had a mental health issue. Everybody knew it. And yet we are hesitant to address the help that is available. I'm a woman of faith, and people say, oh, just pray about it. Well, there are some things that need more than prayer. There are some real chemical issues. There are that need to, just like if you fall and break, then you have to have a reset. You can't just wait for a broken bone to grow back on its own. And so with mental health, I remember, I'll share this story also. For years, for 12 years, I worked for the city of Philadelphia. I was the director of the Minority Business Enterprise Center. And the only reason I say that is as we were reviewing the contracts for pharmaceuticals and who would get the city work for providing prescriptions to city employees, we're reviewing the contracts, and the number one drug, the number one pharmaceutical that was being prescribed to city employees was Prozac. And no one ever talked about the stress that city workers were feeling, and yet the number one pharmaceutical to city employees was Prozac. When in fact, what that should have shown is maybe we need to have a mental health department just for employees. Now, maybe people would have been afraid of that, but the point is, mental health, it is time for us to start normalizing it, because there are more people impacted by it, and particularly in this COVID environment, whether it's you're dealing with COVID, because there's a stigma attached to people. They're afraid to tell people if they've tested positive. And so what does that do to you when you're dealing with an illness and you've got the symptoms and there's no one you can talk to about it? And you've got to quarantine. Then if there's a loved one who dies, you can't go to the funeral. You can't visit in the hospital. You're looking at loved ones in a nursing home through a window, and they're looking back at you, and depending on if they're in a stage of dementia, they see you, but they can't understand why they can't touch you because you're on the other side of glass. And so we really need to start normalizing mental health just like we look at substance abuse. We have acknowledged that drugs can create challenges, that alcohol can create challenges. It's time for us to start acknowledging mental health, particularly in the Black and Brown communities.
Thank you so much for sharing that, Marla. It's something we certainly see every day, and we are trying to do the work of normalizing. I think one thing you mentioned is a small population of serious mental illness. So those are your psychotic disorders and schizophrenias. I think those are the things that people see and get really afraid. But they're not thinking about anxiety or depression or grief as mental health issues just the same. So I think when we think mental health, we kind of go to the worst case or the most serious cases of mental health issues. Another thing, sort of hearing Dr. Muhammad talk about Spectrum, which is the beauty of it serving the community for so long. I think of like some of our staff members, like Miss Juliet, who's been at Spectrum. She's one of our medical assistants. She's been there, I think, about 20 years. She knows generations of families. Like, this is a woman who knows your mom, your grandmom, and your great grandmom, and she's helping you deliver your baby. So I think it's the trust that is built over being in the community. And all you can do is stay consistent and say, we're not going anywhere. We really care about your health. We care about your family's health, and just try to do that work and move the needle a little bit day by day, and really give you some of the additional supports, because the burden of our healthcare system falls largely on people of color, that they carry the unjust disease burden. We're really trying to do the work around advocating and caring for the people that are least likely to show up at town hall meetings and raise an issue, and are most likely to be impacted by diabetes, high blood pressure, and hypertension. I mean, so many of our patients have complex care needs. I think I'm a grad school graduate and thinking about how some of our patients have to manage their diabetes and take insulin and sliding scale. I mean, these things are really overwhelming. And I have more faculties and more supports. So thinking about how else can we uplift and make well the people that need it most. And as Dr. Muhammad said, the majority of our patients are insured. So people deserve to get the best care, whether it's in the middle of West Philadelphia, in the middle of Center City, in the middle of North Philadelphia. I mean, no one deserves better care. And, I think about something else you mentioned, Marla, about sort of sole business owners. And a lot of our patients are entrepreneurs as well. So these are patients that have no on and off switch for when their day ends. So yeah, they're up at 6, they're done with work at 7, maybe they're grinding at night. So it's recognizing that when you are a small business owner, a sole proprietor, you are the person. If you're not doing it, it doesn't get done. So it's really important to check in with yourself and do things that are going to replenish, restore, and heal, because you are doing a tremendous amount of work. And the lines get so blurred when you own your own business. So it's really easy to just be go, go, go. And sometimes those really subtle symptoms, headaches or back pain or feeling fatigued, those are signs that your body might be under duress and that you may need some support or help. So sometimes it's really important to just check in and say, am I okay? How am I doing? Because have I been working 100 hours this week to come home and take care of my family? Or am I at risk, so as you mentioned, Marla, like to lose my job, and I'm responsible for people and their well-being? That's really stressful. It's really stressful.
I want to make sure everyone who has a comment or a thought, that I am sure people are marinating on the information. So hopefully the information that has come forth from both Hilary and Dr. Muhammad, you're thinking about it, and you're thinking about how it impacts you or someone you know, a loved one, a coworker, an employee. Feel free to raise your hand. We're coming to the end of today's session. Feel free to just raise your hand. You can make a comment. You can ask a question. We want to make sure that you leave this webinar with clarity and with questions answered. So there are resources that are that we've posted in the chat, but this is your time to raise your hand, make a comment, or raise your hand and we'll unmute you. You can make the comment live, or you can ask the question live. We've got two healthcare professionals here, medical professionals, and they are here specifically for you. So take advantage of this time. It is 9:59.
Thank you so much, Marla. I would like to say thank you for having us here. And I actually have a hard stop at 10. I have another presentation. You know, you can imagine my busy schedule at 10 o'clock. And so I have a minute if anyone has a question specifically directed to me. But my understanding is that Hilary, she can stay on a few more minutes to take on more questions.
Well, Dr. Muhammad, if you have, we certainly understand it is 9:59. We understand the hard stop. If there's anyone who has a question for Dr. Muhammad, speak now, or you'll have to, you'll ask Hilary, or you'll hold it until the next time when we bring them back. I do want to say this is the 5th session of our 6-part series, and the last session will be on the 3rd Tuesday in March at the same time, 9 o'clock. And we are, I just want to go over what we've done so far. So session number 1, and I'm scrolling through to try to get all of the sessions that we've done so far. If Jasmine, if you can help me out, I'm looking for all of the sessions that we've done so far in this series. They're on our.
I can help you. The first one was grieving and healing during COVID. And then the one after that was stress of structural racism and unrest. And then we did stress of distance and virtual learning for the business owner. Wellness strategies for your employees. And then this one. And then the next one will be finding joy during difficult times.
Finding joy during difficult times. So we encourage you to go to our website where you can sign up for the last of this series. Our guest speaker will be Dr. Robin Smith, local psychologist who has kind of been all over the country. So we're fortunate to be able to have her, a Philadelphian who's going to come and share with us as we close out this series. But again, we expect that we will continue. Dr. Samantha Maitland is on the line with our partner from Scattergood Foundation. We expect that we will continue the series beyond March. So make sure you're checking our website for when we offer this. It may not be a series, it may be individual webinars, but we do acknowledge the need for a resource, particularly during this time. We've been dealing with this pandemic for the last year. We expect it will probably go on in 2021. And for business owners, you're concerned about the life of your business. And so as long as we are dealing with these issues, particularly as it relates to business owners and all of those people who fall under your responsibility, workers, family, friends, other business owners in your network, we're going to continue offering these webinars. So if there are no more questions, as we say at church, if all hearts and minds are clear, we want to thank Hilary so much for taking the time to come in. We want to thank all of our guests who have joined us on today. Today's presentation, as Quinn mentioned, will be available on the PIDC website, both the PowerPoint presentation and the audio. We look forward to seeing some of you on tomorrow. On tomorrow, we're going to have our third webinar with our partners at the Small Business Administration. We're going to start at 10 o'clock tomorrow morning, talking about the SBA's Paycheck Protection Program. So for those of you who applied and received funds in 2020, and you are looking to apply again in 2021, you are considered second draw. There's one set of information for you or eligibility standards for you. And for those who did not apply and receive funds last year and you are first draw, then there's a separate set of eligibility standards for you. So we encourage you to join us tomorrow at 10 with the Small Business Administration. And then on next Tuesday, the 23rd, for those of you who are in construction and construction-related industries, we will continue with part 3 of our 4-part construction series, and we are talking about bonding. And so if you are a contractor, a prime contractor, a subcontractor, and bonding is of interest to you or it is a necessity for you, we encourage you to join us for part 3 on the 23rd. And then part 4 of that series will conclude on Tuesday, March 2nd. And then we will talk about construction law, liens, and dispute resolution. There's one other series. We're doing a 2-day series with the Small Business Administration on Tuesday, February 23rd and Wednesday, February 24th. If you are an event operator and you are shuttered during this time, then we encourage you to go onto our website, see if you're eligible, and the SBA is offering the Shuttered Operator Venue Grant. We will have that webinar on next Tuesday and next Wednesday. Check our webinar for the times, and we hope to see you there. It is PIDC's effort to try to get this information, as much information that is relevant to you as the business owner as we can. We appreciate you and look forward to being able to be what we consider a trusted advisor. So with that, it is 10:06. We thank you and we look forward to seeing you on tomorrow. Hilary, thank you again, and all of our friends, Spectrum Health Services.
Thank you for this opportunity. It's been a pleasure.
Great. All right, everyone, be safe. Be careful with the weather.
Everyone. Thank you so much.